Moving on now, health experts are raising alarm over the misuse of antimicrobial drugs known as antibiotics, warning that it accelerates the rise of multi-drug resistant infections, which are leading to untreatable infections and increased mortality rates. Now, emphasizing the importance of advocacy, the UK Aid, in partnership with the Fleming Fund, has organized a week-long intensive workshop for media and CBOs in Lagos State. Elizabeth Kasham was there in our reports.
Uncontrolled sale, yes.
The launch of the 2.0 National Action Plan in 2024 by the federal government serves as a clarion call to integrate human, animal and environmental factors as key drivers in combating antimicrobial resistance (AMR). Health experts during the workshop raised concern about the interconnected nature of antimicrobial resistance and outlined strategies for effectively addressing the issue.
Coming to Nigeria, the figures are very high. Low and middle income countries tend to be disproportionately affected by things like this: drug resistance, high prevalence of infection and all that. So in Nigeria, 263,400 deaths were reported to be associated with AMR, according to the same Gram study, with over about 64,000 deaths directly linked to AMR.
The message that we're trying to pass here is that people should not be using indiscriminately antibiotics except if they are being prescribed by a doctor. And if they are prescribed by a doctor for them, they should use these drugs according to the regimen that the doctor prescribed them for them.
The private sector, as we have it now, is a hub for a large pool of data as far as AMR is concerned, and engaging them or involving them in national AMR mitigation program will be very, very helpful.
Director of Bacteriology, Parasitology and Urology at the National Veterinary Research Institute, Plateau State, Dr. Sati Ngulukun, warned that without strategic interventions, AMR could reduce Nigeria's GDP by 5 to 7% and diminish livestock production by 11% by 2050.
The foundation has been set. We now have a national technical working group. We have a national One Health steering committee, national One Health technical committee, and also the AMR national technical working committee. This committee is, started with the responsibility of, giving a direction as regards to antimicrobial resistance, prevention and control for the country.
Dr. Nguluku further stated that the economic impact of the antimicrobial resistance AMR will persist if no action is taken, as global deaths could rise to 10 million annually by 2020, with Nigeria projected to account for 263,400 cases. Elizabeth Kasham, ASO Television News.